August 14, 2019. This is a joint meeting of the Commissioners Court and the Hospital District Board of Managers. Item number 2 from the regular agenda. Receive a presentation on the El Paso County Hospital District FY 2020 operating and capital budgets. Item number 3, discuss and take appropriate action on the El Paso County Hospital District's capital and operating budgets for FY 2020 and proposed tax rate.
Well, welcome today to our special meeting. Thank you for being here. And I will continue to thank UMC for everything that they did in a time of crisis, the coordination, the way you handle things, the professionalism makes us all extremely proud of knowing that we have that kind of support at any time, anything that happens. So thank you very much. And I've been asking, convey that to everyone at UMC. Just very proud that we have at least some touch points, and Jacob and your team, and thank you very much.
Thank you. I've got a great team, so I'm really proud of them.
Thank you.
Thank you. Judge, may we have UMC go ahead and read in their item as well? Thank you.
Yes.
Good morning. El Paso County Hospital District Board of Managers and the El Paso County Commissioners are meeting in a joint meeting for their special budget work session. Today is Wednesday, August the 14th, 2019. The time is 9:08 a.m. We do have a quorum. I'll read into record our 2 agenda items. The first, discuss and take appropriate action regarding the fiscal year 2020 El Paso County Hospital District operating and capital budget. Agenda item number 2, discuss and take appropriate action regarding the proposed 2019 tax rate for the El Paso County Hospital District.
Okay, Judge, are you all ready to have El Paso County Hospital District present an update since
Yes.
our last meeting?
Yes, we're ready for the presentations.
Well, I think, there was some questions that were sent to us, I think from Commissioner Perez and others that we might want to address, unless you want us to go through the presentation again, which I remember was sort of lengthy.
No, I think we had agreed at Commissioner's Court, Mr. Cintron, that we would have you addressing the questions that were sent to you, and I think you're right. Everything else, I think we're pretty clear. Just if we could have some of the responses that we send out to you and your staff.
Well, I know that one that was raised on Monday was Commissioner Robinson asking us if we were to go ahead and initiate the $11 minimum wage at the first quarter of the fiscal year versus the last quarter, what the impact would be. And it would be it would be an impact of about $4.5 million, just the $11 minimum wage, including compression, as opposed to about a $1.2 million in the fourth quarter, where we traditionally have made these market adjustments. The merit evaluations are done in March. Market adjustments have been done, I think, in July. So that's when we would enact the $11 minimum wage if approved. Any questions, Michael?
Well, are there any,
Michael?
I guess, other questions regarding the $11?
Depreciation.
Well, are we completely done with the $11
Commissioners,
minimum
any
wage discussion, or
further?
are there further questions on that?
I don't.
No? Question?
So I know there was a
Okay.
question sent to us yesterday from Wally related to Commissioner Leon. You had questions on the depreciation, how it's calculated and how it impacts our numbers.
Yes.
And also over and above that, still on the depreciation, I know that last year it was also in the range of about 28 million to the low 30s. And I'm just wondering, is this different equipment, different capital items every year?
Yes, from the, what our depreciation policy is, and this is for all entities, El Paso Children's, El Paso Health, and University Medical Center. University Medical Center has the majority of it. I think there's about $30 or $31 million of annual depreciation expense. El Paso Health is like maybe about $1 million, and so is El Paso Children's, with UMC having the majority of it. What it is okay, half of UMC's depreciation expense is for all our buildings. And that's about a $15 million annual depreciation expense. And what this is, most of it now that we are depreciating is from all the major improvements we've done over the last 10 years. I think there's been probably about $300 million in total to the plant. So with that, there's estimated annual, or we've estimated the annual useful life of that anywhere ranging from like 22 to 27 years. There are different components of it. The bricks and mortar is one piece, and then the actual components of the building is another, for an average composite life of ranging from 22 to about 27 years. Then there is our major movable equipment. As well, in terms of a lot of the hospital equipment that we have. There are fixed equipment, which are actually attachments to the buildings, and then to a lesser extent, then we have some of our IT equipment as well. So our IT equipment is usually depreciated over 3 years, since that turns around pretty quickly. So with that, we do follow straight line method. So what that is that if an item is about $10,000 in cost and there's an estimated useful life of 5 years, straight line method is defined as taking $2,000 annual depreciation each year. And we also follow what's used in the industry, in the hospital industry, and not only here in Texas but throughout the nation, is we follow the American Hospital Association. They publish an estimated useful lives report, which we use, and it's broken down by category for buildings and what the estimated useful lives, what they're recommending, major movable equipment, minor movable equipment, IT items. We use that a lot for our Medicare cost report guidelines. So that's the method that is predominantly used throughout the industry. Annually, when BKD comes in to do our financial audit for any new items that we have added on during the year, they look to see what the assigned life, the estimated useful life that we have used, just to ensure that it's within reason. We're not being too aggressive or too conservative, and so those are the methods that we use for the hospital's annual depreciation expense.
I'm sorry.
It's Letty. Good morning. And if I could add, as we're adding the assets, it depends on when we put them in operation. Okay, so this fiscal year, as you know, we put our big computer system, $20 million worth, in operation in the month of June. So it's at that point that we start the depreciation expense calculation that goes live. Okay, so at that point is when the depreciation expense starts impacting the books. So in 2020 budget, you have a full year's worth of that expense now impacting that. So if you can imagine, if our expensing of that $20 million now has a 7-year life, you're going to have a full impact of that. 20 million divided by 7 years starts hitting you, and it's a big dollar amount that's now impacting your books.
And when it drops off, whether it's 7 years, 10 years, 5, it's not recycled again, right?
No, it's done.
No.
It's done.
No, so what happens there is that it's always moving. So the older equipment, if it's a 5-year, say we purchased items 5 years ago and now it's fully depreciated, even though we may still be using the equipment in-house, it still remains on our books at its original cost. It's fully depreciated, but it stays on our books, and then at that point in time, there's no more depreciation expense taken on that equipment, and now it's the new equipment or the new projects that are in place, which comprises the annual depreciation expense.
When we have a balance sheet, it really looks at what is the value of your assets, fixed equipment, cash, everything. What is the value of the organization? So when we buy these things or acquire them, it builds up the value of the asset known as the El Paso County Hospital District. But then we know that there's a depreciation, and so to keep an accurate value of what our assets or our value is, there are formulas and schedules put out by different entities that determine at what rate should you reduce that value every year, as opposed to waiting 10, 15 years, you eliminate the piece of equipment, say it's a computer, has a 3-year life, and we reduce it at the 3rd year, we then have to, on the balance sheet, take the full hit at that point. So really, it's a way of being able to recognize that if an equipment has a 6-7 year lifespan, that 1/7 of that value is gonna drop every year to the 7th year when it goes to 0. And then that way, if it's eliminated, then there is no impact to the asset, to the balance sheet at that point, because we've been gradually writing it off according to accounting standards. So the question, I think, was, well, what does that do to the cash piece? And it doesn't impact cash. I mean, when I would look at our depreciation value and its impact on our net position, I would hate seeing that number. But the reality is, it has no impact on what we respond or reflect as what the cash position is of the hospital.
And that was the main drive in my question. But I know you took some time to look at it yesterday and today, so thank you very much.
And I think there was another question, Vince, related to, our tax rate growth from 2013 to 2020. And we broke it down by INS and M&O. And then we also calculated the growth in uncompensated care. And if you deduct that, assuming it uncompensated care from 2013 to 2020 stayed flat, then what would that true M&O growth would be? And Michael's run the numbers.
Yeah, so yes, going back to some of the questions yesterday, back in 2013, our maintenance and operations property tax revenue was about $64 million. When you add the $10 million of interest and debt service, then that comes up to the $74 million number back in 2013. Currently, right now, what we have in the proposed budget for fiscal 20 is that the maintenance and operation portion would be about $96 million. So that portion alone has grown about $32 million since 2013. On the interest and debt service component, where it was about $10 million back in 2013, now that's about $24 million now in 2020. Now there was two items that have been added to the interest and debt service component. Back we had the 2013 bond issue, which was the $150 million bond issue to build the ER clinics, and then also to finish the inpatient remodeling of floors 5, 6, and 7. That was back in 2013. And then in 2017, when we refunded the initial 2005 master facility project, now that initially was not included in the interest and debt service component for many years. So back in when we were refunding that issue, that's when it was included in the interest and debt service component. So that's the reason for the increase in the interest and debt service component. Now back to the property tax, back to the maintenance and operations portions. Yes, from that. With that, the maintenance and operation, that has, if you're comparing 2013 to what we have proposed in the 2020 budget, that's about a $32 million increase. In that time, when we're looking at estimated uncompensated care cost to provide, that has grown from, it was about $144 million back in 2013 and is now about $190 million. So there's most of the reason in terms of the increase in the maintenance and operations portion have been used to offset what has been the increase in the estimated uncompensated care costs.
I think what Michael did too is he ran it that if we show the M&O from 2013 to the proposed 2020 budget growing $32 million or 50%, if you take out or take into account the increase in uncompensated care from 2013 to 2020 of $190 million, the variance is about $14 million. If you take, considering the M&O has to cover that loss, and you take that out, excluding uncompensated care growth, our M&O increase would be about 28% from 2013 to 2020 proposed. Wasn't sure if that answers your question.
Okay.
Any other questions that we might be able to answer for you?
Betsy, does that cover from what you, just want to make sure we address each one of the questions that were asked by commissioners?
Particulars, issues, the timing of the increases, the depreciation, the tax rate change over time. The specifics, the other two issues that the court specifically discussed were if the hospital district was to not go to the full rollback rate, how would that impact their overall budget? And I believe Wally had provided them a number, if it was only 5% versus the 5.6% of an increase.
Commissioner Pettis?
Good morning. Thanks to everybody for being here. Thanks to the Board of Managers always for your work, for the public's awareness. Again, these are volunteer positions, and it's a significant responsibility that our Board of Managers have overseeing such a large hospital district. So, again, thank you for your service. One of the things, personally that I've been wrestling with, and looking at, the increases to revenue, it's just the fact that, well, here on our side, we're in a unique situation where local governments are going to be capped, at the 3.5% revenue cap, which fortunately doesn't apply to hospital districts. And so we feel that we have some flexibility, at least moving forward, with the hospital district, when it comes to our tax rate. And I think particularly, as you all have discussed, the capacity issues and the likelihood that we're going to need to increase capacity, and a likely bond issuance this fiscal year is also going to add demands, onto that M&O rate. And so we're sort of preparing for that, and it's not unlikely that, the ask would likely be to go back to the rollback rate the following year, which I think, given the capacity issues, I think is understandable. And so that's just something that I've been wrestling with is, looking at all the information that you all have provided us, and looking at, this Commissioner's Court, has provided, significant tax increases year over year. Last year being a good example. We went down to the effective rate. We've, cut taxes here at our organization, but we didn't do the same to UMC. Recognizing it is that you all, need that. So that's just been the challenge, is that, in this particular year where I think, is it appropriate for us to go to the rollback rate for all the entities that we oversee? I still don't know. And I think, when I look at UMC, I feel at least there's some breathing room there to continue to go to the 8%, where we're not going to have that breathing room here at the county. And I know it's not, we're completely different organizations with different needs. But when I just look at El Paso County and, the collective bargaining, we had a collective bargaining agreement that we just negotiated this year that's putting pressures on this year's budget, which is unique over the last 5 years. And as much as it pains me that, to even consider having to go to the rollback rate, sometimes it's just necessary. And I think it's sometimes just a cop-out to always just vote no on tax increases. We have to be fair in our evaluation of tax increases. So I think that's a difficult part, is that when, given those circumstances where there is some breathing room, I think to come to the Commissioner's Court, in just my opinion, in a year where I think you all are going to have flexibility in future years, it makes it difficult then for us to go through this budget and say, well, where can we cut? I think that's where we really depend on you all, is it really absolutely necessary to go to the rollback rate? I haven't been able to answer that in the affirmative and say yes. Again, when I look at your all's budget and your all's needs, I hear what you're saying about uncompensated care and your all's cash position as well. But then, if that were the case, if that we're going to just measure our increase in the M&O just based on uncompensated care, well, then that's really the only thing that we should look at. I mean, when we talk about, the increases to folks on the minimum wage, when we talk about to these other priorities and these other merit increases, I mean, then if you're just going to base it, I think, or if you're going to look and compare at the amount of uncompensated care, well, then that should just be the end of discussion, right? It's the amount of the increasing amount of uncompensated care, and the tax rate isn't going to cover it. And is that our goal? I don't know. And I think overall, that's just something that we need to look at. And I've heard y'all mention, the the amount of revenue that other taxing entities generate from other hospital districts. It was an average of 38%. And I understand what we struggle with this as a taxing entity. But, when you look cumulatively, at their property values as a whole, unfortunately, El Paso significantly lags, behind our peers. And I think even with this proposed rate, this rate will probably put you all at either number one or number two when it comes to, in terms of the highest tax rate of your peers, of the top 5 hospital districts. And that's just something I try to be mindful of. Where do we as El Paso County stand relative to our peers? Where does the hospital district stand relative to our tax rate? But then also given the limitations of our property tax base, we are going to have to unfortunately tax our residents more, for so many of the reasons that you articulated, the uncompensated care costs. But it's all of those things I hope that we're trying to wrestle with at this point in time.
And I understand. I think, and it may be disingenuous to speak about the hospital district, but say the county. And I get the resistance to do rollbacks. But if the rollback for the county, avoiding that means that there's less services to the public, then I think that's not right. I mean, the whole issue is who likes running over areas that need the funding to be able to keep them up to proper standards. So when it comes to the hospital, from our standpoint, it's not just the uncompensated care. That's a big portion. And the uncompensated care provides funding for those that don't have properties or don't have jobs and that need the care. The other thing is that, and it was brought up at our last joint session, we wanted to get to the average of what the other safety net hospitals were in terms of the percentage that property tax revenue would be for our total revenue. It would require many, many years of maximum rollback. We don't intend that. There's no way that this city could support that, or the county. So the problem is, I think, being here only for about 3 years, is for many years past, even prior to you all serving as commissioners, I think that really we started falling behind as a district, and for whatever reason, the avoidance of wanting to increase tax or whatever, we fell behind. And now we're playing catch up. When we look at the added headwind of picking up the El Paso Children's Hospital, who is now in a much better position because we did that, that says a lot. The investment in our hospital with the buildings and the services that have increased benefit the community, which has helped us generate more revenue, which then releases some pressure on the property tax side. So when you look at our current FY 2020 budget proposal, we know that our cash position needs to grow. And so part of this rollback is to help us pick up some of that. Additionally, though, it also includes the $11 minimum wage, starting in the fourth quarter. If there was no $11 minimum wage push, we'd break even. And yet, here's the thing. Right now, we're looking at an $11 minimum wage, an impact of maybe 1.3 million to our FY 2020 budget. That's starting in the fourth quarter, which means that in FY 21, it's going to be in effect for the full year. That's going to be about a $4.4 million impact. So whatever little we gain with a rollback today will dissipate greatly in FY 2021 because our expenses continue to grow. Additionally, we do our best to try to generate additional revenue, whether it be through the things that we propose in increasing services our community needs, but to do it in a way that hopefully breaks even or is accretive to our bottom line. I understand what you're saying. I can't, at the end of the day, I feel that the district for many, many years was not as aggressive as it should have been to try to cover its expenses. Today, I don't see any possibility, now or in the next 10 years, that we were able to get a tax rate that'll cover our uncompensated care. It's not going to happen. And I think as much as it is the right thing to do, it is a disservice. We cannot do that. And we know that. Right now, our challenge is going to be, how do we start building our cash balance so that we can have more sustainability in terms of the operations of the hospital. And yes, we are facing bed constraints and other service constraints that would look at the possibility of us coming back for a request for a bond. These are things that I think we're doing a disservice to our community if we don't bring to your attention. If we reduce our rollback rate, and I think Wally gave us a percentage which would impact us by about 700,000 reduction. My recommendation there would be to reduce or postpone the $11 minimum wage till the next fiscal year to see if we can afford it then to be able to do that. Our capital request that we've received is about 30 million. We pared it down to 15 million. We've reduced that at UMC from 15 million to 10 million. So we're not funding our ordinary capital request to the level we should. Eventually, we're going to pay a price for that because equipment will start aging out before we can replace it. On top of that, the original budget we prepared was pared down another 2 million with all the entities contributing to that. So, we're looking at a 1% merit increase, 1%. I believe other entities are looking at a much higher percentage. We're looking at trying to get to an $11 minimum wage, which was a request last year by the commissioners, and I believe you all are going to a $12 minimum wage. So we're trying to, some of the things you see in our budget are things we need to do from a fiscally sound standpoint. Some of these things are at the request of the commissioners, which I don't disagree with. We want our associates to be paid fairly. We want to reduce our turnover rate. We want to make sure that we treat our people right because as we have seen through the years, when our associates and our contractual obligations with Texas Tech and others is done right, when our patients need the care, it's going to be there with the professionals that we've hired through Tech or through our associates and others to provide the right care for our people.
If I may add
Thank you, G.
as well, too, one of the things, once after the Children's Hospital became part of the district, one of the goals that we had, management had, and then as well as the Board of Managers had for us is, we need to try to get to break even. Back in 2017, we were, $40 million decrease in that position. And I think there's a slide, if Letty can maybe try to, it's towards the end, as to how that's been improved over the past couple of years. And this will probably be the first time in several years that we're as close to break even as we can. And one of it is to the rating agencies in terms of, we had our first ratings call with Standard & Poor's a week ago. We had some follow-up questions with them. They were, at least some of their comments were very positive in terms of the improvements we've made over the past couple of years in terms of looking forward down the road in terms of future bond issues. I'm thinking about the rating agents, what's UMC's ratings in terms of could it be improved not only by one, the improved operations over the past couple of years, two, we're that much closer to break even to get a better bond rating so that if we do come back and when we do come back for a bond issue, that the interest costs and debt service costs in the next 20 to 25 years would be that much less. So those are some of the external factors as well in trying to come up with this balance in terms of where do we end up.
This is Letty again. We also have this huge opportunity, right, with the rating agencies that if we're able to break even and we were able to show them that we're working so hard, combined with your support to move this forward, and in our next potential refunding or potential new issue, that it could make a difference for better rates, better rating, and ultimately the taxpayer could benefit from that too. So again, this is an opportunity that we have combined.
And when you look at this current fiscal year and where we're at and projecting, when you compare us to prior fiscal year, the improvement, I believe, has been close to about 18 to 20 million over the last year. And we're looking at coming in a little ahead of budget this year. So we have looked at everything. We've looked at our supply contracts, continue to look at those. We looked at our staffing for productivity efficiencies. We've looked at our drug costs. So we continue on the expense side to look very closely at how we can reduce the expense side. For this coming fiscal year, we're going to be looking at revisiting our managed care contract with our payers to see if there's opportunities there to be able to generate more gain. On the fiscal side, they've done a very good job in terms of implementing efficiencies to reduce denials from insurance companies to increase what we generate in terms of patient revenue from an adjusted patient day. So when you look at those pie charts that show here is our percentage of property tax revenue versus the other 4 safety net hospitals, and we're at 21%, 23%? Even with the rollback, if I remember right, we actually drop from 23 to 21%. So even with a rollback, we're losing ground. But the flip side of that is look at net patient revenue and premium revenue. When you compare it to the other 4 safety nets, we're running supercharged. When I look at the other safety net hospitals and what percentage of their revenue comes from net patient revenue or premium revenue, and I look at ours, we are working really hard to try to minimize the amount of tax revenue we need. And I think in part because we recognize this, we live in this community. And so we, look at the progress we made in 2019 and what we're looking at trying to do in 2020 in terms of trying to get as close to break even as possible. I look at the progress of FY19 over FY18. And again, our budget depends on your support. And I know you will do the best in terms of your decision as to whether to support it or not, and we will respect it. And if it means we've got to trim something, we'll trim it. But keep in mind, some of these things we would trim are the very things you all have asked us to look at, and things that I agree are important to do. So I guess so much for my soapbox. If there's any questions, I sort of used up the time, right?
Okay.
I'm sorry.
Jacob,
Okay, I have one more.
No, and we do thank you because, on a personal level, it's a very thoughtful, you could see the energy and what it took to get to this point. And, the fact that we don't have specific things for you to cut means that, in my particular situation, is that I really couldn't find things that we haven't requested or that the Commissioners Court had proposed. And so when we're proposing growth and proposing quality care and proposing clinics and accessibility, and then at the same time we're concerned as to how you're going to arrive at that, that made it difficult for me to say, you're growing, our population is shifting, and we need more services in areas that we never needed service before. So it's very difficult, and the fact that you have the opportunity, like we don't have the opportunity, we have a cap, that you have the opportunity to be able to do the things that you need to do, not knowing if next time you guys have a cap and then you catch yourself behind, that was a strong consideration. I know how things can shift to the other side, and now the hospital district gets a cap. That would be very detrimental to our community, that if you haven't done what you need to do to the extent that you can do, and then find ourselves in a situation where our community gets hurt because the legislation decides that you're going to have a cap next year, and we don't know that. And I'm not saying that you overuse just because you might anticipate a cap, but I haven't found anything that I would say would be detrimental to, maybe we want to get to that $11, and we have companies that come in and we scrutinize and we talk about not coming in because they don't reach our minimum wage, and then we have our own organization not getting there as fast as they should. So I just want to, we have to balance the things that we want, and then what is it going to take to get there. And so, like I said, I thank you, because it's obvious that it was scrutinized. There's not any fluff or things that you could readily say, why would you want to do this or this other? I haven't on a personal level. That's just my opinion at this time.
And one last comment, and I think Wally touched base on this yesterday, was that our Medicaid supplemental area, that's one of the most volatile areas year after year. It goes up, it goes down, all upon the signature of a pen, whether in Austin or whether in Washington. This year, starting October 1, unless things do change. I mean, we're getting about a $4 million reduction to our Medicaid disproportionate share payments. And that's all, and that's all mandated, by Congress. Without that, I mean, that'd be $4 million additional that we would have. UMC is being affected by about 3 million, children's, by about 1 million. But that just speaks to some of the volatility that we have in our government funding.
Commissioner Robinson?
Let me put a personal perspective to this situation as far as UMC. Where would I be if there was no UMC? If there was no UMC, the one we have here today, you wouldn't be hearing my voice. I wouldn't be here. Another entity, and I'm speaking from a personal standpoint, that there's a lot of people that may fall in the same category. And it is not so much for the fact that whether I have financially able to pay for my medical care or not, that's irrespective. The other entity almost cost me my life. It's kind of hard for me to say, because I'm not a crier, but if you were in my shoes back a few months ago, and one day you were walking and talking and doing everything that you normally do, and the next day you're not able to do anything for yourself at all. Nothing. You go to a facility and you think that the facility is going to take care of you. That's their mandate. But this one facility failed me. Literally failed me. I was within hours of being buried at Fort Bliss Cemetery. Within hours. And if it was not for UMC, they saved me. But where would I be if there was no UMC? I wouldn't be here. I promise you, I was not here. I'm just telling you what personally happened to me, not going into any details. You'll hear the story about it at a later date. But I was within hours, ladies and gentlemen. And I'm not one to rarely say we need to raise taxes. I like to keep my money in my pocket rather than give it to anybody. But there are times when you say we have needs in our community. Now, how many other people that may have failed or fall in the same category that I was in just a few months ago? Compared to, if you saw me at the beginning of the year, you saw me walking, you saw me running, like I was running for office back in November, the November election. I traveled a lot of miles on my feet, knocking on doors, waving, standing on street corners. But a few months ago, after that unfortunate situation, that could have, I'm not a medical doctor, but I know my physical situation, that could have been easily taken care of and should have been easily taken care of, but it wasn't. There was a failure in the system. But I'll tell you, ladies and gentlemen, UMC saved me. And I have a whole lot of gratitude to Jacob and his crew. I call it the doctors that took me to the A-team because they were on the ball. They immediately assessed the situation and put me on the track for recovery. I'm still going through some of it right now. I'm not cured. My situation is still, one day I'm able to, you'll see me around here. One day you see me walking, and then like yesterday and today, I'm back in the wheelchair. So I'm still going through a process. But I tell you, quite frankly, ladies and gentlemen, a few months ago, if UNC did not exist and come on board and say, we'll take care of you, I promise you, you would not be hearing my voice. You come visit me at the Fort Bliss Cemetery, because that's where I was going. So sometimes we have to take a look at, for us, as elected officials, our duties for us doing the budget, making decisions, but then you also think about it sometimes, how many other people out there that need the care that's provided by UMC, and where they have no other recourse to go to. So how many other people that did not have access to UMC, or because of the fact some of the decisions that we make or have made that don't allow them the care that UMC provided because we had to cut the budget, we have budget restraints. But how much is one life? What's the value of one life? You tell me. Is it worth a few dollars? Is it worth $1 million? Is it worth $10 million? You cannot put a value on a person's life. But life is precious. I want to stay on this good earth as long as I can. I want to stay here till I get 100.
You didn't have to sit next to me.
David? I'd rather be sitting next to you than being at Fort Bliss Cemetery. So I say, ladies and gentlemen, once again, we have a lot of constraints as far as finances, revenue, but at the same time, we got to have UMC. We have to give them the tools they need to make sure that not only Carl Robinson is taken care of and being able to stand up and say, I'm still alive, that a lot of other people that may be in the same situation I was in, that may not have the access to go to UMC, and maybe that family can say, my loved one is still with us because of UMC. God bless you.
Thank you, Commissioner. Betsy, anything else that we need to cover? Christina, can you guide us at this point? What are our options at this time?
You all are posted for action today. However, you all do have 2 hearings that are scheduled for the 21st. The public hearing is scheduled on the 21st here in the Commissioner's courtroom at 6 o'clock for the public. You're also scheduled for Wednesday, August the 28th for the second public hearing for members of the public. So you need to go through those hearings. So I don't hear any action for today.
Anything else?
Are there any other follow-up items that our team can get for you so that we can help you in your analysis of this?
Yes, Judge.
Commissioner Robinson.
One thing, I know that, Jacob, you guys have restraints as far as physical, financial situation, but as a minimum, I'd like to make sure that, I'd like to see that the employees are taken care of. The $11 an hour minimum, as well as we said 1% in the fourth quarter. If it's all possible to do a better job of that, would be great. But as a minimum, I'd like to make sure that we see the $11 minimum and the 1%. Because I always say that my time in the military, that our motto was, you take care of your troops and troops take care of your mission. We got good staff.
The same way with our associates. We're just an empty building. So I know currently in the budget, the $11 minimum wage would go into effect in fourth quarter, and the merit reviews would go in, I believe, in March, which would be the third quarter? Fourth quarter.
And then the merit increases annually, usually happen in the month of December, once after our annual evaluation process is completed during the months of September, October.
So second quarter, roughly.
Roughly, yes, sir.
Thank you.
Commissioners?
One thing, Ms. Flores, thank you so much you've been very responsive to my staff, and I appreciate it. And I'm short one staffer. He actually just had a baby today at midnight, so I want to just throw my shout out.
He had a baby?
Yes.
We'd like to see.
So, but one thing, if you would be, and I'm making the same request of the county, just of the position, of just all the positions with no names associated with them, but just and salary tables associated with that. I appreciate all your responses to the other inquiries that we brought forth, but that was the only one that was remaining.
Okay. I guess just one other thing. I left a package in front of your place settings, and it's just a little bit more detail on a couple of items that I'd like you to review before we go forward. One is the in front of you in a clip is the detail of the capital budget. This should be a detailed line item. It should look like this. Do y'all find it? There was a handout on your place setting.
No, I don't think
They just didn't give you one,
I guess
Commissioner.
I don't know if you have an extra copy.
Yeah.
Oh, I have it.
You found it?
No, we got it.
Okay, so Vince, this is, you had initially in your big binder had a detailed, just a summary. So this is the detail, but Frank just informed that El Paso first number needs to be updated. So I will resend this to all of you with the final updated figures here. But you should get the detail updated with all the capital line items exceeding $100,000, okay? So again, you're gonna get this detail for capital items via email. The second sheet that you have in your packet, this was to augment the request, Commissioner Leon, regarding depreciation, just to give you the background that Michael already spoke to regarding depreciation in our books. I won't rehash that again. And then the last piece was regarding Betsy's question from our last work session regarding the correctional health budget. This was regarding her question about including the EHN component for correctional health. And so just to quickly review this, we met with Wally and to review what we had in the budget. So in your first gray column is what we initially proposed in your budget binder, which had operating revenues of $8,024,000. And what we are going to recommend after review with Wally and Betsy is that we increase that to include the EHN budget, which was not inclusive in your packet before, and increase that up to 10.8. So we will revise the budget that you have on hand to include that component, and we agree now to the figures that you see here, okay? It'll only mean an increase of $259,000 to the net position, but we will be agreeing to the values that you will have in your books to match ours at that point, okay?
Thank you.
Thank you.
So,
Yeah,
Commissioner Pettis?
Something I would recommend would be, it's nice to see the board. I feel this is the only time we really get to see each other on an annual basis. Perhaps, it could be warranted to have maybe a mid-year joint meeting. I'm sure you all as a hospital district go through strategic planning. I don't know if there could be a component for the Commissioners Court. But, something that I think that would be helpful. In a lot of ways, when you outline, different things, I think they are helpful, when you point out, the percentage of revenues that other hospital districts get, when you point out the gap in uncompensated care, for me, those are helpful metrics. The question is, what's our target? Where do we want it? If we know that we can't be at the 38%, where do we want to be, right? And I think if there was sort of mutual agreement that, look, this is what we're shooting for, that would be quite, because then it's just easy for every year just to say, look, hey, we're not at the 38%, we'll need another increase. But it's the same thing with the compensated care, we're going to have to continue to monitor that spread. What do we think is an adequate amount where tax revenue should be going there? So that way it helps provide us a sort of a guiding point, rather than just saying that, there's always going to be the gap, unfortunately.
What we can do is when we do our quarterly presentations that are, financial, I know that every other quarterly, so it'd be the 6-month mark, we could, in the conference room, or it's mostly financial, we can talk about, here's the financial position currently in this year and how the strategic plan is impacting it for the next few years so that you're aware, where are we heading 10 years from now, 5 years from now? What does that mean on the operations side? What does it mean on the INS side? And we can share that with you.
Yeah, no, the updates are actually quite helpful, and we appreciate all the time that you and your staff take to update us on a quarterly basis and more so, and then also Jacob for meeting with us as much as you do. It really is a big departure from the prior administration, and it helps tremendously. But I'm saying, perhaps, we could explore the possibility of a joint meeting with the Board of Managers, mid-year, so that way it is, we're all on the same page.
No, I think that's a great suggestion, because as we went through it, a lot of it was not questioning, but sort of understanding. And when you're at the end of the year trying to figure things out, I think if we go through it throughout the year, as Commissioner Perez suggested, and then look at our strategic plans and how they work together. And so, I think I just really respect the kind of partnership that we have, and maybe we could find more ways to have touch points throughout the year that'll help us, not have to be bringing you back and forth. I know you guys are busy. We got volunteers, and I think we could maybe provide a swifter kind of process that by the end of the budget, instead of waiting till the budget and try to figure out or ask questions and so forth. So
I think it's a great idea. We're glad to do that.
well, we thank you with that. Thank you for being here, and thank you for this partnership that we're always trying to strive and continue to improve. Thank you very much.
For item number 3, no action, and this completes all the items on the agenda for today, Judge.
For the UMC side, there is no action taken this morning. May I have a motion to adjourn? Thank you. The joint meeting with the El Paso County Hospital District Board of Managers and County Commissioners is officially adjourned. The time is 9:58 a.m.
This completes today's meeting at 9:58 a.m.